Well, welcome to this video. Today I want to think about the recent attention that vitamin D has been getting, because I think that's a really good thing, because the combination of vitamin D and dexamethasone correctly used, I believe, has got the potential to save a lot of lives. And I want to focus on vitamin D today, but just before I do that, I'm just going to say a couple of things about dexamethasone. Lots of people have written to me saying, I knew dexamethasone worked weeks ago or months ago. Well, the answer to that suggestion is that you didn't know. You didn't know. You guessed. We only knew when we had the trial data. This is why we had to have the trial data. So quite a few people are looking back and saying, oh yeah, well, we had it right all along. Yeah, that's right, you did, but you were guessing. You only know when you've got the trial data. So moving on to the vitamin D. Now, the reason I'm a bit optimistic is there's been quite a lot of publicity lately. So this is from the Daily Mail. It's not my style, as you'll see. Terrifying chart shows how COVID-19 patients who ended up in hospital may be almost certain to die if they have a vitamin D deficiency. Now, this is from a study in Indonesia, which I'm going to give you the link again for, but we did report on this in great detail at the time, quite some time ago now. Good 6 weeks ago, more probably. Indonesian experts have analysed hospital records of 780 people who tested positive. Now, those who were vitamin D deficient, so those with vitamin D deficiency, this study shows that 98.9% of those died. But for the ones that had plenty of vitamin D, only 4.1% died. And I remember at the time jumping up and down about this, saying how important this was. And at the time it was basically ignored, but now it seems to have been picked up by the media, which is good. So we've got these figures here. We've got 98.9% dying in those that were deficient, 4.1% dying in the group that weren't deficient. So that's pretty interesting straight away, isn't it? And this is now to be reviewed by SACN. Now, SACN is the UK government body responsible for investigating these things. And it actually started looking at this last month in May. And it stands for the Slow Committee Against Nutrition. Oh no, sorry, I've just made a mistake. It doesn't actually stand for the Slow Committee Against Nutrition, slip of the tongue. It actually stands for the Scientific Advisory Committee on Nutrition, which advised the British government and Public Health England. To apologise for that sarcasm, but it just beggars credulity that they only started working on this last month. Public Health England and NHS regulators, NICE, are doing a separate review. So we've got this Scientific Advisory Committee on Nutrition now looking at it, looking at vitamin D. Public Health England are looking at it, and of course this committee feeds into Public Health England. So they're looking at it. And the National Institute for Clinical and Care Excellence is also looking into it. They're doing a separate review. Some might say better late than never. Now, if you want to look back, I mentioned this first on the 28th of January. And then in great detail on the 9th of March and a couple of times since then. Now, I put this on. This is not to me mouths off saying I guessed it right, because these statements I was making on the 28th of January weren't guesses. What I did was I looked at the data. Now, I'm just one ordinary guy. It just happens I can read. And I read the scientific papers and I thought, vitamin D, viral infections. And I joined the two together. I mean, how hard is that? I mean, I'm not particularly bright. I just did it. It was easy. You know, and many of you did the same thing as well. And yet the government groups don't quite seem to have got there. So the government group started work in May. We flagged it up in January, but this was just based on things that were in the basic, just things from the basic public domain scientific information that was out there. This is not anything mystical, just basic reading with a bit of common sense. And as you know, since then, most days I've been taking this, and it's 25 micrograms of vitamin D, which is 1,000 international units. Now, how much vitamin D you take, you need to talk about that with your doctor ideally, because it is a bit complicated. I might go into some of the complications of why it's complicated later on, but I want to get some basic information out first. Although lately I've been working at the allotment in the sun with my shirt off, which has been unpleasant, as I've said before, but I haven't bothered with this because I've been getting plenty of sun. And it turns out people in the States don't know what allotments are. So an allotment is a small patch of ground that you rent off the council and you grow food on it. That's what an allotment is. Now, this Indonesian study that they're talking about here, this is the study here, and do check it out for yourself. Patterns of COVID-19 mortality and vitamin D, an Indonesian study. So we talked about this, I think pretty well as soon as it came out. It was on a video as soon as it came out. We talked about this in some detail with other evidence, and what we did, we also compared this with other evidence that supported the case for the efficacy of vitamin D in prevention. And you might remember the graphics that Liz did for us that I will show you again later in this video as well, that we did as a consequence of this information. Vitamin D is a risk factor. So this group adjusted for confounders. In other words, in this study, they found what you would expect. They found that older people were more likely to die. They found that men were more likely to die than women. They found that people with diabetes or hypertension or heart failure or chronic obstructive pulmonary disease were more, or dementia. They found that those people were more likely to die. We knew that, but they adjusted for all that. So that was all adjusted for. And when that was adjusted for, people with vitamin D insufficiency, so people whose vitamin D was down a little bit, were 7.63 times more likely to die, and people that had the very low levels of vitamin D were 10.12 times more likely to die. So I mean, this data has been clear for some time, and the p-value there is high. So the probability, well, the p-value is low. That means the probability that this result arose by chance is very low. So there's a 1 in 1,000 chance that this is not a genuine result. The p equals 0.001. So this is highly significant data, and we emphasised this at the time. You know, this is not new stuff, but it's coming to press attention now, which is good. Vitamin D supplement to prevent acute respiratory tract infection. This is just one example. We talked about this on the 15th of February. We talked about this. So vitamin D supplement was safe and it protected against acute respiratory tract infection overall. British Medical Journal. So the British Medical Journal knew on the 15th of February. I knew on the 16th of February, and this committee seems to start its work in May. I don't know if it was early May or late May, but you know, what were they doing all this time? It really is quite incredible. Disparities in the risk and outcomes of COVID-19. Now, this was the report that the government was all singing and dancing about a couple of weeks ago, because we knew that tragically, as I've been flagging up for some time, as many of you have known for some time. In fact, I'll just show you the graphic, because that's highly pertinent. We've known that people from black, Asian and ethnic minority groups in the UK are more likely to die when infected with COVID-19. So Liz kindly did this superb graphic for us weeks ago. And it shows this, that the lighter coloured skin is bad because it burns more easily in the sun, but produces vitamin D more quickly. Darker coloured skin is good because it protects from sunburn, but produces vitamin D at a slower rate. And for example, we know that African Americans are, the vast majority of them are deficient in vitamin D. And at the time I suggested this to be the principal cause in my view, of why people from black and Asian ethnic minority groups were dying at such a disproportionate rate in the UK. And so the government commissioned this great big thing on it, and I read it all. It's remarkably boring, and they talk about, I can't remember now, but they talk about economic factors and sociological factors and institutional factors. No mention of vitamin D. I mean, it's just unbelievable. And yet Liz had provided this graphic. You know, and again, this is not me and Liz being particularly clever. This is well established, well known stuff. And the government, the UK government, manages to write a whole report and completely ignore this basic, obvious variable. Now, in the last few days, the Guardian newspaper, now the Guardian does some good information on health. Don't like it for everything, but it does good information on health. And the Guardian have published an exclusive. Now, the Guardian have said it's an exclusive, so it must be an exclusive. apart from the fact we were talking about it in January, of course. But the Guardian says an exclusive, so that's good enough for me. It must be an exclusive. Scientific Advisory Committee on Nutrition, SACN. Does that not stand for Slow Committee Against Nutrition? No, the Guardian, I've got it right. The Scientific Advisory Committee on Nutrition, that'll be right. So they began work last month, May. Hooray. Hurrah, they've managed to start. Considering recent evidence on... I apologise, I'm being a bit sarcastic, and it's really not good enough. I'm going to stop it now. But it really is difficult to understand how they've been so obtuse. Obtuse is the word. They've been obtuse. Considering recent developments on vitamin D and acute respiratory tract infection. Good. Glad to see they're doing it at last. Evidence will be considered on specific population groups. Good. As per Lizzie's poster. And the National Institute for Health and Care Excellence are also working on this. Now, this is what the Guardian's reported. So they conducted a rapid, they're conducting a rapid evidence review on vitamin D in the context of COVID-19. So this is the Guardian exclusively reporting, that NICE are doing this rapid assessment. And they also quote Professor of Respiratory Medicine in Immunity. Vitamin D could almost be thought of as a designer drug for helping the body to handle viral respiratory infections. So me and the professor agree. I'm not a professor. No, but seriously, it's good to hear people of this calibre making such clear statements. And there's a couple more. He also said it boosts the ability of cells to kill and resist viruses and simultaneously dampens down the harmful inflammation, which is one of the big problems with COVID. Now, we know this, don't we? The lungs become inflamed as part of this so-called cytokine storm. And again, Liz had all this covered weeks ago in this poster that you may well remember. The role of vitamin D plays in protecting your lungs. So this inflammatory reaction in the lungs, where the lungs fill up with fluid, the vitamin D are making this less likely because it's modulating the effects of these white cells. So in the same way that dexamethasone combats the cytokine storm, this is postulating that as well as making the viral infection less likely in the beginning, as well as having an immunological function to help the body protect against the virus, the vitamin D also modulates the immunological inflammatory response and stops the inflammation going into overdrive, causing too much inflammation. So again, it's working in both ways. It's working in this antiviral, well, it's working in this immune system optimizing way, which is de facto antiviral, but it's also dampening down this fatal, or potentially very fatal, cytokine storm. So another good effect there. High levels of melanin in the skin lead to lower levels of vitamin D. This is the Guardian saying this, so if the Guardian are saying it, then the Guardian aren't known for pointing out differences between races, shall we say. High levels of melanin in the skin lead to lower levels of vitamin D creation, which are exacerbated in countries which have less sunlight, like the UK, like the northern United States, like Canada. This causes the immune system to be weaker. In other words, I'm going to put it in a less delicate way. I'm going to say darker skin produces vitamin D more slowly, and that is, I believe, why many of these people have died. Now, that brings us on to the report on ethnicity. Now, this is from the government. It's a UK government report on ethnicity, vitamin D and health. So it's a bit slow, but they are addressing this directly now, so that's good. It's just a pity that so many people have had to die in the meantime. Vitamin D and health. Annualized mean vitamin D concentrations. So this study's been done now in the UK. So what they took vitamin D blood samples from different people in the UK at different times of the year. Now, what you have in the UK is people tend to go out in the sun more in summer, so the vitamin D levels go up. And then they don't go out in the sun in winter because it's too cold. So what you find is the vitamin D levels progressively drop over winter and are at their lowest about April. And then they start going out in the sun again, and then the levels start to pick up again. So the levels vary throughout the year, as you would expect due to sun exposure. So they took the average concentrations, the mean serum concentrations. That's the amount. The serum is the part of the blood that you spin down in the lab when you want to test for things that are present in the plasma in life. So white adults, they had 45 nanomoles per litre as an average. Asians, Indian subcontinent, primarily in the UK. Now in the UK, when we say Asians, we mean primarily Bangladeshi, Pakistani, Indian. In the States, when you say Asian, you tend to mean more Chinese, Japanese, Korean. So Asian in this country are people who are from the Indian subcontinent primarily. So their levels were half, less than half, 20.5 nanomoles per litre. And people that were black in the UK, 27 nanomoles per litre. Now, at first you might think this is surprising. So white people, no surprise. But people so black people obviously have darker coloured skin than Asians, and they have higher levels. So what accounts for the difference? Well, it's behavioural. Black people are quite happy to go out sunbathing as a rule, whereas many Asians don't, especially women, especially Muslim women, who are covered all year round and are very deficient in vitamin D. So that accounts for the different levels. But we can see even in the black British population, 27.7 as opposed to 45.8. And this is already quite low. This is already quite low. So basically, I would say that means the entire population is vitamin D deficiency. And particularly Asians and black people are vitamin D deficient. How hard is this to work out? So the government are recommending 10 micrograms of vitamin D, which is 400 international units, proposed for the general UK population aged 4 and above. Not for me to advise you what to take, but I'm taking 25 micrograms. In fact, most of the time I've been taking 50 micrograms a day. The British government recommendation is 10 micrograms a day. I'm taking 50 micrograms a day when I take it. And they say to serum concentrations to be greater than 25 nanomoles a litre, which I would consider to be well into the deficient range. People should take 10 nanograms per mil. So we see that the recommendations here are very, very conservative. These are, in my view, remarkably small doses. But hey, it's not for me to argue with government reports, is it? Scottish Government likewise has already published, so the Scottish Government's ahead of the game, vitamin D advice for all age groups, published on the 3rd of June. Remember when we started talking about this? January? Scottish Government published on the 3rd of June. Again, they're basically advising 10 micrograms, a very small dose. Specifically recommending that groups at higher risk of vitamin D deficiency, that is people with darker coloured skin, people that stay inside all the time, take a supplement, or pregnant and breastfeeding women, they're advised to take a supplement. Infants and children under 5 years old are advised to take a supplement. And people who have low exposure to the sun. Particularly people in care homes, for example. Who's died most in this outbreak? The people with the lowest levels of vitamin D in care homes. This is the Scottish Government again. I'm not going to bother reading it all, it's a bit boring. It's fairly obvious. Well, people from minority ethnic groups with dark skin, such as African, Afro-Caribbean, South Asian origin, who require more sun exposure to make as much vitamin D. So these are the people that should be taking supplements, according to the government, the Scottish Government. Scottish Government recommendations: 10 to 15 minutes of unprotected sun exposure is safe. 10 to 15 minutes in Scottish sun is not much for most of the year. Now, this is an important point, so I will concede to the Scottish Government on this, but again, we've been saying it for years. Once sunscreen is correctly applied, vitamin D synthesis is blocked. So this is unprotected sun exposure we're talking about here. Staying in the sun for prolonged periods without the protection of sunscreen increases the risk of skin cancer. Okay, that's true. But you know, they're being remarkably conservative here. Basically, reading between the lines, they're trying to say you need vitamin D, but I'm not going to take the risk of recommending how you get it. That seems to be what they're saying to me. It's rather pathetic, actually. Too much vitamin D may be harmful, but you'd have to take an awful lot. Daily supplements of the recommended amount will be enough, so they say. Avoid high daily dose vitamin D supplements, more than 100 micrograms for adults and more than 11 and children from the age of 11. So what they are saying is, so these are 25 microgram tablets that I've told you repeatedly I'm taking. What the Scottish Government is saying is you should not take more than 100 micrograms. That's 4 of these. So the Scottish Government is saying don't take more than 100 micrograms. In other words, it's saying don't take more than 4,000 international units a day. But I've been taking 2,000 international units, which is 25. And of course, you probably saw that excellent interview with Rahul, who's originally from Kerala, living in Germany. And he started in January, I think, he started off taking 1 of these a day. Then he went up fairly quickly to 2. And his vitamin D levels were 5 nanograms a mil in January. And I think when he took it again in early June, I believe he took it again by taking 2 of these a day. They'd gone up to 33 nanograms per mil. So Rahul's vitamin D levels were dramatically improved by taking 2 of these a day. He took 50 micrograms a day. That's what Rahul did. And that is consistent actually with what the Scottish Government's saying, because they're saying don't take more than 4 of those a day. So in other words, the Scottish Government is saying you should take 10 micrograms a day. That's what they're recommending, but then they're saying don't take more than 100, which is a heck of a range, of course. So you can see why they're being rather conservative. So my duty is to report to you that the Scottish Government is saying don't take more than 100 micrograms a day. They're advising not more than 50 micrograms for children and more than 25 micrograms for infants under 12 months. So they're the upper doses that they are suggesting. Now, I've talked to quite a few people in India. I've got quite a few contacts in different parts of India. And I've told them to go to the doctor. And Indian doctors in different parts of the country, I'm not saying do this, but they are giving what they're doing in India. The Indian doctors, in 2 or 3 circumstances I've talked about, that they're giving 60,000 units a week for 6 weeks to top them up, and then 60,000 units per month for 6 months. So that's what Indian doctors are doing. Now, I will mention this. We talked about this in detail when we talked to Matt. How much vitamin D you need to top you up depends on how low your levels are to begin with. So if you've got very low levels of vitamin D and you're obese, for example, then it's going to take quite some time and quite large doses to get your vitamin D up, because when you swallow the vitamin D, if you take it by mouth, the vitamin D goes into the fatty tissue and it's stored there. And you have to fill up the fatty tissue first before the vitamin D spills over into the blood. And if you've got a lot of adipose tissue, that can take a long time. So people that are very deficient and obese can take a lot of vitamin D to top them up, whereas people that have got relatively reasonable levels of vitamin D and are quite thin, then obviously they're going to need much smaller amounts. That's why I keep saying go to your doctor to get a specific recommendation for yourself. So there we go. So we've got this scientific advisory committee on nutrition working on it. We've got the National Institute for Health and Care Excellence working on it, and we've got Public Health England now working on it. So that's good. So what I'm hoping is they come up with realistic expectations soon. Sorry, realistic results soon. And when we get those results, it'll be interesting to publicise those results, because this has got the potential to save huge numbers of lives all around the world. So as we speak now, that we know dexamethasone is efficacious in severe reactions to COVID-19 that can cause inflammatory reactions in the lungs by cytokine mechanisms in people that are on oxygen therapy and people that are ventilated. Now that knowledge is known, now that doctors can read that, a lot of lives are being saved with dexamethasone now as we speak, because we have the trial data. So we really do need the trial data on vitamin D. This really needs to be done. But in the meantime, until good trial data is in, we look forward to the renewed recommendations from the Scientific Advisory Committee on Nutrition, from Public Health England and from the NICE Institute. And they should be out in the next week or two. So that means they're probably out in the next month or so. So we'll look forward to those, and of course, as soon as they're available, I will be reporting on them. Right, let's look at some of you lovely people. Here we are. Who have we got today? Here we have Caroline from Liverpool. So Caroline from Liverpool, as we see, is taking vitamin D and watching on her smartphone. Wonderful, Caroline. Thank you for that. Glad to see you watching in Liverpool. Good. This is Francis. Now, I wonder where Francis is. From... I can't say it. Worcester, I guess. Sorry about that. I am a bit dyslexic. Anyway, it's in Massachusetts. Francis, I'm delighted you're watching. Let's just say in Massachusetts. And my rap, I think, is going around the world. Now, I strongly suspect that there's people out there who are better singers than me. So if they would like to sing this for me, I'm more than happy to play it. It's really will rock you, isn't it? No mask on your face, you big disgrace. Thank you, Francis. Spreading your germs all over the place. Good to see you watching, Francis, in Massachusetts. Thank you for watching. This was interesting. Now, who sent me this in? Francisco from Barcelona. Now, this is interesting. So, Barcelona, northern Spain, of course. It looks like the milk there is fortified with vitamin D. So, without this, it's reasonable to assume that the death rates would have been even higher. So, it looks like there's 1.5 UG, that's a mu, that's micrograms. What I wrote as MCG, micrograms, per 100 mils of milk. And 3 micrograms per 200 ml glass of milk. So we don't do this in the UK. So it could be that it transposes, that trial data shows in the future we'll know for sure, or more like much more certain to know, that saved a lot of lives in Spain. This is Gav, who watches in a city called Old Rishi, which is Edinburgh. My dad told me that when I was a kid. Edinburgh was called Old Reekie, which means smelly place. But of course, Edinburgh is now a very, very clean city, apart from the diesel fumes and the microparticulates. Anyway, I digress. Glad you're watching, Gav, in Edinburgh. This is Humbart and Pinnett, who live in the Upper East Side in Manhattan. So glad to see you're watching. Yes. This is Michael in Hereford. Now, Michael's going to get a special mention because Michael not only watches my videos, he makes broccoli soup. And you may remember that I showed you how to make broccoli soup on a video while talking about the nutrition. So might put a link to that again. It was quite good fun. So broccoli, of course, is very, very good for you. So that was Michael in Hereford. It actually looks better than mine, Michael, I must say. So do hope you enjoyed your soup. Good one. This is Ninja Granny, better known as Judy in Toronto, Canada. So great to see you watching, Judy in Canada. Thank you for the picture. Vitamin D and vitamin K2. Very good. This is Paul, who also watches in Toronto, Canada. Just guessing, but Paul might be a Star Trek fan. But glad you're watching, Paul. Great to know you're watching in Canada. This is Raymond and Kit in St. Paul, Minnesota, in the States. So glad to know you are watching together in St. Paul, and thank you for the picture. This is Robin, who's in British Columbia in Canada. Looks like Robin's a musician, so he might record us something, you never know. But good to know you're watching, Robin. Thank you for sending that picture in from British Columbia in Canada. This is Wayne in Oregon. I think Wayne might make models of the virus, which of course is very interesting. So that looks pretty cool. Anyway, glad to know you're watching, Wayne in Ontario. Good news.